Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. The possibility of a new variant of coronavirus has emerged. Twin spikes of the Delta and Omicron variant known as DEMICRON. Deputy Governor Bauchi State and top-ranking officials get a booster shot, flag off third COVID-19 dose exercise. And U.S. daily COVID-19 cases hit highest levels since start of the pandemic. Thank you for joining us. While there were 1.8 million recorded deaths in 2020, there were 3.5 million in 2021, and we know the actual numbers is much higher. That's according to Dr. Tedros Ghebreyesus of the World Health Organization. He says that millions of people are also dealing with long-term consequences from the virus. The unvaccinated many times more at risk of dying from either variant. According to him, right now, Delta and Omicron are twin threats that are driving up cases to record numbers, which again is leading to spikes in hospitalizations and deaths. He says this is and will continue to put immense pressure on exhausted health workers and health systems on the brink of collapse, and again disrupting lives and livelihoods. He believes that ending health inequity remains the key to ending the pandemic. Meanwhile, so far, Lagos State remains the epicenter of the pandemic and is managing over 12,000 cases as the state battles the fourth wave. The FCT is next with over 3,000 cases on admission and Delta 2,296. Meanwhile, states like Sokoto, Kebbi and Kogi have 0 cases on admission. Here's more on the pandemic update.
355 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 9 states and the FCT. It shows a significant rise from the figures reported earlier. Lagos had the highest number of cases with 1,036 infections. Nasarawa had 92 cases. Delta and the FCT came in next with 58 and 57 cases. Edo came in with 44 cases. Rivers logged 25 cases. Delta following closely with 23, while Enugu turned up with 11 positive samples. Plateau and Bayelsa came in with 6 and 3 cases. The total confirmed cases in Nigeria now stands at 240,374. This report includes a backlog of confirmed cases from Lagos State. No cases were reported from Sokoto State. 311 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 213,491. There was 1 additional death, raising the fatality toll to 3,028. Currently, there are over 23,000 active cases in Nigeria, while over 3.8 million samples have been tested so far. Almost 10 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 4.4 million persons have been fully vaccinated. In Africa, over 9.5 million persons have tested positive, while over 227,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 284 million, while deaths are beyond 5.4 million.
And reports just in has it that there might just be a new variant, this time called the DEMICRON. Now, from what we're hearing, it's twin spikes of the Delta and Omicron variants, not a new and separate variant of the coronavirus, but the Delta and Omicron strains together, which we understand is fueling the COVID-19 cases around the world. Well, joining us to talk some more about this right now, Dr. Akela Ishako is a virologist, and he joins us virtually. Thank you for joining us on the program. tell us, is it confirmed that this is a new variant and one of concern involving the Omicron and Delta?
Thank you, Melissa, for having me, and compliment of the season. Scientists in India just discovered that there was an upsurge of Omicron variants in India. And so they went into genomic sequencing and they discovered that there was a swap in the genes between the Delta variant and the Omicron. And so they submitted the genomic data to the WHO for actually to come up with a position whether it is a variant of concern or not. But it has also been established in the United States of America that it is responsible for the tsunami uprising cases of SARS-CoV-2 or COVID-19. Melissa said you will agree with me that in early December, cases of Omicron in the United States of America is just 1%. As we speak today, United States of America is counting 73% upsurge in number of cases of COVID-19 with increased hospitalization, increase in mortality rate. So because it has been established by genomic sequencing that there is a swap in the gene between Delta variant and the Omicron, that is why the name DEMICRON comes into existence. And so in the coming days to come, it will fully be established that whether it is the Delta variant of concern. But the Indian government have also on their own, established that it is a Delta, it is a variant of concern. It shows that Nigeria will just need to be alert. It shows that we need to mount securities, health securities on our border. It shows that we need to intensify surveillance. Even locally, Melissa said that there is a community transmission of Omicron in Nigeria. So Nigeria needs to go deeper into genomic sequencing to establish that. So we need to put more of our searchlight on our borders.
Dr. Akiale Shaku, really this is raising loads of concern, considering, that we are still yet to get over the new variant Omicron and what it's doing. So essentially quite a big threat. But we have a situation where some countries, including Nigeria, are yet to vaccinate a good number of its population. And then hearing about this, how can you reassure them that this is not necessarily a threat and that, we can survive this in view of the amount of vaccinations that we have? Because there's also the argument about the question of the vaccines and the boosters being enough to tackle these new variants that seem to be materializing.
Actually, Melissa, so we just need to be hopeful about it. Be hopeful that the future holds bright and 2022 holds bright, that will bring this pandemic to an end. But we just need to do more. Just like the way I said, we just need to do more. There are hopes that the existing vaccine can take care of the new variants. I first of all told you that from literature and from the data that was established in India, that based on genomic sequence, that there is a spike, that is a swipe in the gene mutation of both Omicron and Delta. And if the vaccines that we have on ground can be able to take care of the new variants, it shows that the mutation in the spike protein as a combination of these two variants, it shows that the vaccine can also be still potent. But the question is the availability of the vaccine. And so we need to intensify more a campaign on the uptake of the vaccine to be able to break the cycle of vaccine hesitancy, and also be able to think inwards that we need to do a lot of studies too. Melissa said, we are just waiting for data from United Kingdom, from United States of America, and even from South Africa. How about the Nigerian data? What is Nigeria contributing to the global landscape in the fight of this pandemic? Since we have started giving out vaccine, we have not yet actually checked the antibody titer to look at how long do they last, whether we need a booster dose or not, because there are variations also in the genetic makeup. Israel is talking about the fourth dose because they have data to support that the antibodies does not last longer, and that's why they're initiating fourth dose. We have not yet taken, we are compelling people to take second dose. But the booster dose, and we are talking about the fourth dose. So we need to actually go into research to establish, does population within Africa, due to our genetic makeup, do we actually have a long-lasting immunity to these viruses, to these different new variants of viruses that are emerging? So these are quite key issues that we need to look into. Melissa, and I'm expecting that in 2022, we should be discussing about Nigerian data contributing to the global landscape of the public health pandemic.
Just before we let you go, as a virologist, I think you can best answer this question, and that is, what was the possibility that this is a virus or a strain that's coming up in India? Was there something that happened, you know, was there a letdown of the rules? What exactly could have caused, you know, both twin spikes, you know, appearing as DEMICRON, and why is it peculiar to India?
Okay, it was actually, the genomic sequencing was done in India, but India also linked their data to the spike in Europe and part of America. And so they also established that most of these variants might have been responsible for the tsunami in Europe. So it is not only limited to India. If you look at the genomic modeling, they are also establishing that it is also linked to the spike in the United States of America. Right. Melissa, you know that this is a festive season all over the world. You know that a lot of people travel to meet with their loved ones. There are a lot of carnivals going on in India now, even in the United States of America, because of the Christmas season and the festive season in part of Europe. Here in Nigeria too, you can discover that we have entered into our fourth wave because of the season that we are in. We have lost our guards. The issue of the adherence to non-pharmaceutical interventions even in Nigeria, a lot of citizens don't adhere to. This is because we are gradually losing our guards. And so it calls for a concern. I'm not a prophet of doom, but if you look at the modeling in terms of public health, genomic epidemiology, you will discover that we are expecting to have more positive cases as we turn down 2022 January. This is because a lot of people, schools will open up, workplaces will open up, closed centers, settings like banks, like corporate organizations will open up. People that don't adhere to non-pharmaceutical measures will have interface with people, and then there will be a systemic transmission of this variant. And we expect seropositivity in terms of community transmission. So it calls that we need to actually come up with stringent measures to see to how we can enact laws that people can actually, adhere to pharmaceutical measures. I was glad that one of the guests that you actually have an interface with, shared his, thoughts with you by saying that why can't we have an integrated approach that most of these paramilitary and security agencies can also be integrated in the fight of COVID. We expect the Federal Road Safety Corps Marshal members on the road, as they begin to check, inspect vehicle papers, also begin to, pass out the public health a message to people on the use of pharmaceutical, even in terms of police, like that. So this is quite key. Nigerians, COVID-19 is real, and then we begin to see how we can bring survival of this, and then begin to also integrate non-governmental organization to push the drive in terms of communication. Because, the National Orientation Agency are far left behind in this, and also, so we need other non-governmental organization to come so that we can have an integrated approach to be able to fight this pandemic.
Thank you so much for taking out time to talk to us about this very important matter. Dr. Kiale Shako is a virologist. Thank you so much for joining us on the program.
Thank you for having me.
With the Omicron variant of COVID-19 swirling the number of infections around the world, fast taking over the dominant variant in Nigeria, even though more states and others are experiencing a rise in new cases, it is partly to blame for the current surge. A visit to some public places in Taraba State, northeast Nigeria, shows that some are not even aware of the existence of the Omicron variant. Our correspondent reports on their expectations from government, which includes more education and sensitization.
It all appears to be a return to the usual lifestyle of residents in Taraba State as they go about their day-to-day activities without adherence to the safety measures of COVID-19. A closer look at buyers and sellers at the Jalingo main market is a clear indication that the guard against the virus has been lowered without a wash-hand basin in sight, carefree exchange of pleasantries, and no face masks. Apart from the disturbing non-compliance, some residents say they're not aware of anything like Omicron and thought the pandemic was on its way out.
Oh, I don't know about it. I don't know about it at all. I don't know about it. I never had it. Yes, I don't want people to be dying of this, the virus. So see, even me, I don't know about it. I don't know about it. I need government to put more eyes on it and then to enlighten people about it.
A friend of mine told me about it. He said it's obvious because I was having catarrh. When I informed me about it, he said I should be very careful because the virus is around again. Yes, and that's how I'm being careful. That's why you see me on face mask.
The state government says the situation is worrisome and it will not relent in advocacy and sensitization to achieve total protection, despite claims by some residents.
To be frank and candid, we are not happy at all and we are not comfortable with the way and manner our people are not adhering to the National Center for Disease Control social distancing protocols, which all of us are supposed to at least adhere to. But what do? Ours is just to continue to inform, educate, and above all, advocate our people to embark upon that. If they do, it's for our own good. If they don't, we're in it together, but God forbid.
Taraba expects to start administering booster shots in the coming days, but much awareness must be needed for the exercise to run smoothly.
Away from Nigeria, as at the 29th of December, Ghana recorded 1,074 cases of COVID-19. Up until the recent cases, it had reported a total of 9,455 cases between the 16th and 29th of this month. Fred Smith, a health editor at Joy News, Accra, Ghana, joins us now to talk more about the COVID-19 wave. Hi, Fred. Thanks for joining us this holiday period. Tell us about the wave in Ghana. Are there more cases due to the festive season?
Yes, indeed. Ghana was actually expecting our cases to rise during the festive season. And indeed, right from the 13th or the 15th, of December, we saw a sharp rise in our cases, and we're recording now at 1,324 cases per day. And this is from just 27 cases a day on December 1st. And so it tells you Ghana's cases had jumped so high in a very short space of time. We were expecting that on Christmas Day, the cases will go up significantly. Fortunately for Ghana, there has been a drop, not significant though, but there has been a drop, and we're recording 1,074 cases on Christmas Day. That is good. It's something that will improve our situation if we continue to observe the protocols following the measures that were instituted ahead of the festivities.
And perhaps before we come to those measures, about the Omicron variant, how is that significantly affecting the surge in cases in Ghana?
Well, it's not been confirmed, but health officials or the authorities believe that considering the sharp rise in cases, the wave is likely being driven by the Omicron variant of the virus. And so that's the suspicion, even though the scientists are still sequencing to establish if indeed this is what it is. To tell you, Ghana has since a month ago, I beg your pardon, discovered that the Omicron was already in Ghana, and this was detected from some travelers, Ghanaians who traveled to Nigeria, and on their return, this was found in the samples that were taken from them. Since then, the sequencing is still ongoing at the University of Ghana's Center for Disease Control, and that has not produced a result yet. And once we have that result, we'll know. But the Ghana Health Service believes and has said that the whole of last week that they believe it is the Omicron that is driving this current wave.
Ghana also appears to have taken a firm stand about mandatory vaccinations, barring unvaccinated persons who will arrive in the country from December the 29th. I mean, and that's just yesterday. Has this started? How are people reacting to it as well?
Well, just this afternoon for the Greater Accra region, where the capital is, there was a Security Council meeting which reviewed the protocols in place, and that review, persons who want to visit the beaches are free to do so, but they have to go there and show proof that they have taken the vaccine and they are fully vaccinated. So, for instance, if you're heading to a beach, you'd have to show that you have a vaccination card, which will be checked before you are allowed in. The security has been deployed to these areas. The health officials at the beaches as well, who are checking to be sure that everybody who is getting access to a beach has vaccinated. Beyond that, persons who are walking on the street, if you are driving with other passengers in your vehicle, are all supposed to wear the face mask, and these measures remain in force. However, right from the 1st of January, everybody who is entering a government facility will be required to have vaccinated, not just wearing a mask, but you are required to have vaccinated. And I have before me now a statement from the Health Ministry, which says that they resume work from the festive season on the 4th of January. And on that day, even staff who are entering the facility would have to show proof that they have taken a full vaccine before they get in. A double dose of those that require the 2 doses, and a single dose for Johnson & Johnson is the definition for full vaccination.
How are Ghanaians reacting to all of these measures to keep them safe?
Well, unfortunately, the requirement for mask wearing is being ignored almost everywhere, especially in the Greater Accra region where the cases are high. We have about 90% of the country's current cases in the Greater Accra region, but the residents also don't observe the protocols that have been instituted, and so you see a lot of people on the streets without face masks. You see a lot of people attending parties and going to the pubs and to places where, in fact, have been banned, have been told to shut down, are operating, and people go there not wearing the mask. And so the observance of the protocols have not been the best at all, and officials have been complaining about that. The other issue has to do with the vaccination, and a lot of people have also not taken that seriously. Ghana has vaccinated a little over 10 million people, at least with a single dose. The target was for 20 million people to have been vaccinated fully by the end of December, and you realize we have just a day to end December, and we have around 10%. Just yesterday, the president had to review that target to first quarter of next year. And so we hope that people will come forward and get vaccinated, but it has been very slow as we speak.
All right. Fred Smith, health editor, Joy News, Accra, Ghana. Thanks so much for joining us on the program.
Thanks for having me.
The number of daily new COVID-19 cases worldwide has crossed 1 million for the first time since infections were first recorded 2 years ago. This according to a tally. The pandemic began in 2020. New infections in the United States have soared to their highest level on record, largely driven by the highly contagious Omicron coronavirus variant. Here's more on the COVID-19 global update.
New infections in the United States have soared to their highest level on record, largely driven by the highly contagious Omicron coronavirus variant. The number of new daily cases has more than doubled over the past 2 weeks, eclipsing the old mark of 250,000 set in mid-January. Australia has also hit a new record as it narrows its definition of close contacts of coronavirus cases and relaxes requirements for COVID-19 tests in a bid to relieve pressure on testing sites.
We cannot have hundreds of thousands of Australians and more taken out of circulation based on rules that were set for the Delta variant. We need rules for the Omicron variant so we can keep our economy working, we can keep people in jobs, we can keep Australia open, and we can focus the resources that we have on the tasks that are most urgent.
The country is grappling with the rapid spread of Omicron after most states eased tough restrictions, and like other countries is betting on the highly transmissible variant being much less severe than previous variants. Never before seen surges in COVID-19 infections in France are leading some French people to get jabs as soon as possible. France is seeing a tidal wave of COVID-19 infections with 208,000 cases reported over the past 24 hours, a new national and European record. The rise in cases come as the World Health Organization warns that the Omicron and Delta variants could produce a tsunami of COVID-19 cases that will put immense pressure on healthcare systems.
Right now, Delta and Omicron are twin threats that are driving up cases to record numbers, which again is leading to spikes in hospitalizations and deaths. I'm highly concerned that Omicron, being more transmissible, circulating at the same time as Delta, is leading to a tsunami of cases.
In other developments, while most of Brazilian cities have cancelled year-end celebrations over growing concerns posed by the COVID-19 Omicron variant, Rio de Janeiro's famed New Year's Eve festivities will go ahead with scaled-back events.
ChannelTV.com has more updates and a better understanding of the pandemic, plus all the latest stories at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.